So once we realized 77 days ago that this was a real crisis, how quickly did we shut our facilities down?
So, like I said, March 5th was the first day that the county reached out to Quia Delta, and this was planned before and said, we have a potential person that we suspect might have coronavirus, and we would like you to do the sample collection. So we did the sample collection for the county, and then we sent the sample to them, and they ran the test because nobody had testing ability when this first started in California. So we did that March 5th. And then throughout that next week, we started putting measures in place. So that was a Thursday. And then the next week, by Wednesday, we actually had started to limit visitors to anybody could have just one visitor. That was our initial visitor restriction. And so we started to pull back on the volume of people in rooms, the volume of people in the hospital, in the clinics, in the ED, because we knew that the social distancing was one of the main ways to prevent the spread. So we put that in place immediately. And then actually our skilled nursing facilities and our post-acute areas, our rehab and our skilled nursing facility on Court Street and on Acres, they went to no visitors by the 12th. The 12th and 13th were those 2 days they totally eliminated having visitors in their buildings. And that was in response to the very high risk when you have people that are in a more of a living situation versus an acute care setting. So those residents and patients in those buildings would intermingle, they'd eat meals together. So they started very early with meals in the rooms, no visitors, controlled visitors for family training, and their screening of people coming in and out because of the high risk there. And then the command center opened on March 13th. And we opened it that evening officially. We had been working in response teams throughout that first week, but knew that we were going to have to do a larger incident command approach because just of the magnitude of what was going to have to happen, because it wasn't like just the ED would be impacted or just the hospital would be impacted. Every single one of the clinics, our therapy clinics, our home health team, our hospice team, everybody going out to homes, everybody coming in for visits, everybody would be impacted. So it would take more than a core team of decision makers. It was going to take the entire healthcare district for this response.
And in hindsight, looking at skilled nursing facilities, that was such an amazing decision that was made at that time to shut that facility down. And we still have not had positive patients there or any kind of outbreak.
Yeah,
So,
we have
so
not
grateful.
had,
Yeah.